Hello everyone, I'm Hala Shoman, a Palestinian from Gaza, and a social and political activist. Today I'll be sharing with you my article, hopefully will be published soon. It's about Israeli genocide and reprocide in Gaza. Testimonies about the assault on Palestinian reproductive health during the genocide. This has been written as a request of many Palestinians in Gaza themselves. They asked me to write it and to expose the realities and crimes that are committed against them and doesn't have enough exposure in media. I'll start sharing now my presentation. So looking at this T-shirt, in 2008, 2009, Israeli aggression over Gaza, I was in Gaza. I was about 12 years old, and I remember that there was some Israeli soldiers that started creating T-shirts that went very viral, and it was very concerning for us as Palestinians, specifically in Gaza, under the Israeli aggression. That T-shirt had a woman, a pregnant woman, as you can see, and she's at the crosshairs of a shooting person, and you can see in Hebrew written and also in English, 1 shot, 2 kills, and it's in the present sense, so it continues for them. And since I saw this picture, I started thinking, and I remembered that in this genocide, Israel endeavor of annihilating Palestinians and combating domestic or reproductive health of Palestinians has been a long-standing historical endeavor. It's not new. That's why I'm starting with this at the beginning. So each time I'm talking about what's currently unfolding in Gaza as a reproductive genocide or reprocide is a continuation of extended policy and strategy against reproductive health in Gaza and the rest of Palestine. In my literature review in my article, you will see that it does manifest in all historical Palestine in 1948, in West Bank, in Quds, Jerusalem, and Gaza, but in different ways. So different tools are used in different places, geographic places that was fragmented by Israel. However, the goal is one: antinatalist policies against the Palestinians and aggression against our reproductive health so they can annihilate the Palestinian and colonized community. And this is also not exclusive for Palestinians. Many other colonizers have committed the same crimes against the indigenous colonized communities in Canada and so many other places that I'll be mentioning in the next slides. So Palestinian people have been enduring the heavy toll of Israeli violence and settler colonialism for more than 76 years. This paper focuses on how Israeli settler colonialism manifests not only through violence and dispossession, but also through systematic assaults on Palestinian reproductive health. This paper introduces the concept of reprocide or reproductive genocide that I'll be using them interchangeably through the article and presentation. Building on Palestinian feminist scholars on politics of birth and Israeli settler colonialism like Kanane or Shalhoub Koverkian and others, this paper develops the concept or again introduces the already framed concept of reprocide to analyze the systematic assault on Palestinian reproductive health in Gaza today for male and females in Gaza. Reprocide is used as a framework that allows us to connect different kinds of violent strategies to make it visible how reproductive violence is working as a genocidal violence in Gaza. Main methodology I'm using in this paper is a combination of autoethnographic account, so my own analysis, my own understanding, my own accounts as a Palestinian from Gaza who lived a few days before the beginning of the genocide on Gaza, and for the writing up of my PhD, and at the same time ethnographic data and accounts sent to me by friends, by people who trusted me as activists from Gaza, and also people who wanted me to be more vocal about what's unfolding now in Gaza, as part of the ongoing genocide, and it doesn't get a lot of attention. So this paper utilizes the concept of reproductive genocide as mentioned by the collective in 2023. And alternatively, I'm using Reprocide that was coined by Ross in 2017, and I'm using them interchangeably. Ross coined the term Reprocide to examine how structural policies and practices targeted marginalized populations aim to control and eliminate their reproductive capabilities and potential. I argue that those actions are part of the broader genocidal project against Palestinians, specifically unfolding now in Gaza. Painter also in 2022 used the same term reprocide and mentioned some examples of that, which is the forced sterilization of Black people, prisoners, and Indigenous people in Canada. And it was made permanently by removing their reproductive organs. So before going to the strategies that Israel, I'm theorizing that Israel is using right now and combating the reproductive health of Palestinians, I need to say some important stuff. At the beginning, when we're looking at the genocide, we need to understand that there is so many other mechanisms Israel is upholding within this genocide, among them the reprocide. And the reprocide is different from genocide itself, is that genocide comes or happens in a certain time, certain place. However, reprocide is a more lasting and have a futuristic potential. So in the reprocide, it's about killing those exist, but also killing those potentially would exist. So those babies, I'll explain more in the next slides, those babies that would have existed and the lineage of families that was cut, and also the children that would have reproduced in the next generations. All of that is cut with the reprocide. So the whole face of the community would be changed forever. And what would the community was going to be if this reprocide didn't happen is much different than what's going to be because it happened. To understand all factors that is used within the reprocide, I'll go through the strategies in understanding them and analyzing how each of them is collectively addressing and connected and causing the reprocide. Reprocide as a term is very important to decolonize the knowledge and also to understand the colonized communities. And how the gendered part of the genocide is being unfolding in front of us. And it's very crucial and important to understand that genocide and Israeli genocidal campaign has some gendered tactics and gendered mechanism to attack the Palestinians, not just by killing them, but also by attacking their very much identity, their physical, their bodies, and their reproductive capacities. So with this, I'm contributing to the feminist analysis and gender analysis, and we need this gender dimension to understand the violence as they are using this violence against women and men, but is exclusively. So to start with the Israeli strategies, the first strategy I'm talking about is reproductive health violence. So all the violence against reproductive health as a way or a tactic to reprocide. Since the beginning of the acute Israeli genocide over Gaza, the 7th of October 2023, until the 14th of August, and the genocide is still ongoing for more than a year and 2 months, Israel have killed more than 17,000 children. 2,100 of them are toddlers and babies below 2 years old. And those babies that existed and were killed are people will not reproduce to the community. So it's not just they were killed, but also those would have come from them were also prevented. So there is a potential life that was lost in that sense with thinking of reproduction. This number doesn't include people underneath the rubble. It doesn't include also those are not reported and they are lost. As for the Save the Children, they have said there is about 21,000 children that we don't know anything about them. They could be kidnapped, they could be imprisoned, they could be having any destiny, and we don't know about them. And the same thing applies to them. So they are potential lives and they carry potential reproductive lives that are now unfortunately lost. It's always said that 70% of those killed in Gaza are women and children. It is important. However, we need to realize that 30% are also men. So the reproductive capacity needs women and needs men. Without both of them, we can't have reproduction. So we're talking about 100% of the population had their reproduction affected. And those 30% or those like the 70% of women and children make us think that the men have become widowers, and also they have lost their children. So they've lost the potential of being fathers and be called as that, and also they've lost the potential to have a lineage and a family extension because they lost their wives and their children. Also, about the health, it's important to know that since the beginning of the Israeli genocide over Gaza, the miscarriage rate have jumped due to all the circumstances that Israel have created to 300%. And this is unprecedented and a very high and concerning level. At least 155,000 pregnant women and breastfeeding women are lacking prenatal care, postnatal care in a community as Gaza, that prenatal and postnatal were very flourishing to the level that we had a pre-pregnancy preparation in Gaza. And all of that now is, it doesn't exist. So women are reaching delivery room or emergency rooms with other injuries, and doctors discover that they are in labor, or women are discovering suddenly that they are in labor because they haven't followed up, because they've lost their husband, their kids, they're running from place to place to shelter, or because of the Israeli forced displacement, or because the infrastructure was lost, so they don't follow up, unfortunately. Long-term reprocide was also created in another dimension, and that's why I'm telling you that Israel is using this tactic and they know about it, because the nuance detailed of how they're affecting everything related to reproduction is very obvious, but we need to see it so we can understand how they are committing it. So in Gaza, there was a massacre against our embryos, extrauterine children, with killing of over than 4,000 of them in an Israeli airstrike over the Gaza biggest fertility center, El Basma. Also, at the same time, the strike have damaged more than 1,000 more specimens of sperm and unfertilized eggs. So we're talking about 5,000 potential lives, children to be, that were prevented. So about 5,000 families who had spent years trying to have a child out of this way have lost their ability of becoming parents. So those 5,000 families wouldn't have lineage, wouldn't have offspring, and at the same time, those 5,000 babies to be are prevented of having lives and having reproductive life after that. So we're talking about something that would have a generational effect over decades of life over us as Palestinians. This is a quotation by the doctor who had established this clinic, and he said, "One single strike and thousands of potential lives were wiped out. For at least half of the couples who were patients at the clinic, many of whom had saved for years to afford the treatment, those embryos were their last chance to get pregnant. So it was their last chance of being parents, of being able to have a reproductive capacity and have extended their lineage to the next generation, which is now prevented." In a research conducted during the genocide between March and April 2024, About 68% of pregnant women had complications, and this is a very high percentage of complications. Among them, 92% had urinary tract infection, 76 had anemia, and many other stuff, among them stillbirth and postpartum hemorrhage. Israel has prevented the supply of anesthetics, so women, men, children had to go through multiple operations without any anesthetics, among them cesarean section for women exclusively. That entails opening the seven layers of women's body without any anesthetics, which is a very painful and traumatizing experience that would hinder many women of thinking of pregnancy again and would hinder other women who are seeing what's happening to the reproducing pregnant women from trying or hoping to be pregnant themselves, and that would affect the ability of the community, all the community, to reproduce. Um, one of my friends, she was happily pregnant after 10 years of her and her husband trying to be pregnant. After the Israeli genocide started, they were at the north of Gaza. They were ordered, as everyone else, to go to the south of Gaza. It was very difficult to them, but and she was denied, she wasn't allowed to do that medically because her pregnancy was dangerous. It wasn't very stable, and she needed some daily injections. However, because of her daily injections were over and she was due to labor, she and her husband considered going to the south so she can find her injections and also find medical capabilities to make her operation safely if she needed one. And that's why they started to walk to the south of Gaza. And at the checkpoint, or what we call al-Halabat, a female Israeli soldier asked everyone to kneel, but the pregnant woman, my friend Hannah, told them, "I can't. I'm pregnant." And the Israeli female soldier forced her to squat as a punishment. She started squatting, and her husband tried to support her. However, the Israeli soldier punished him and abused him physically, beating him simply. And after that, after squatting, my friend Hannah fainted and bled a lot. And her husband carried her and went running to the nearest hospital, where she was admitted immediately to the emergency room. It was very difficult, many people there. However, they were able to having her in labor, and her baby was delivered, however, in a poor health. And this baby also because he's in a poor health, he needed incubators, but it's damaged because of the Israeli occupation, and no others did exist because of the Israeli blockade. So the baby is still in a bad health situation. However, my friend, at the same time, she had a postpartum hemorrhage, which is a bleeding after, a hemorrhage after the labor and delivery. And it's not complicated. It's a simple procedure. There is some blood materials that they could use, and then the hemorrhage would stop. However, because of the Israeli blockade over Gaza, those materials were prevented in this genocide. And because of that, my friend Hannah was possibly going to bleed until she dies. For that reason, the gynecologist and doctors had to decide to remove her health uterus completely to save her life. And it's a procedure not only done for her, but for many other women, and due to the hemorrhage complications in Gaza. So we understand that as a strategic, holistic thing of preventing pregnant women or women from getting safe deliveries. And if they did have one, then Israel makes sure that if they had this complication, that they allow it to happen. If they had it, it would be their last time of having babies and being pregnant. The other strategy that Israel uses is against menstruation and challenging hygiene conditions in Gaza. The ongoing intensified Israeli blockade on Gaza, which includes insufficient supply of sanitary products, all of them are denied to the Palestinians in Gaza. It's very bad for the women who are and girls who are having periods, but it's worse after delivery because the blood or bleeding is more and for longer periods. Hundreds and thousands of women are suffering from acute respiratory infection, jaundice, diarrhea because of the conditions that Israel created that increase the infectious diseases. The impact of insufficient sanitary products is affecting all women and also forcing them to improvise cloth and fabric to use and sometimes to reuse them because there's no alternative of this cloth also because it's rare to find them. That increases the UTI infections, vaginal infections, and reproductive health issues for those women. A friend of mine who was jailed by the Israeli occupation within this Israeli genocide over Gaza, she's 19 years old. She told me that while she was at the Israeli prison, she faced a lot of violence that would affect her reproductive health forever. She told me that in the Israeli captivity, we were held in open barracks in Israeli settlements in Al-Quds, Jerusalem. They were very annoying to us when we asked for toilet. It was like death. We used to get into toilets with handcuffs and never remove them. We were not allowed to shower or be in tahara, so to be to purify and be clean for the religious obligations. They were torturing us a lot in regard to the toilet. Girls who had their period didn't find pads. They were not allowed to have them. They only would give us 1 or 2 baths and insulting and torture us. The weather was too cold. It was below 0. In regular investigations, they used to drag us as animals and insult us because our clothes were filled with blood from the period due to the denial of the period baths. Each time there were steps, they would throw us over them and insult us with plus 18 words that you can read them yourself. The other strategy that Israel uses, and it's very important, is bomb now, die later. And it's a tactic of a reprocide. As part of the ongoing genocide in Gaza, Israel forces have systematically attacked the infrastructure of Gaza. Graham 2005 has called this strategy switching of cities. So they intentionally make Gaza an unlivable place. They bombard and demolish and damage most of the infrastructure of the city. At the same time, they push people and displace them to different spaces to make their life again unlivable. That increases the infectious diseases. That also increases the blood pressure with the stress. It also makes people inhalate toxic materials from the bombardments, from the rubble that is everywhere, and also prevent people from reaching to the basic needed infrastructure like hospitals, educational facilities, and more importantly, their homes and houses, which is their private and intimate space of where reproduction usually happens and people need it for their intimacy. So with all of that damaged together and violated and attacked by the Israeli occupation, they make sure that the reproduction itself is not allowed now, but it's also not allowed in the future. They make sure that people are dying or being killed now, but at the same time, even if the bombardments and murders stop now, the indirect death and murder of infectious diseases, of pollution because of the rubble and the materials Israel have used white phosphorus and uranium, they make sure that those people will continue on dying even after the end of the genocide. About the intimacy, some people are trying to create some spaces for intimacy in Gaza. Among them, in one of the schools, there was a classroom where couples could, married couples could go and have a little bit a private time together. But this is not practical. This is insufficient for a community that's very conservative, and most of them wouldn't go for such solution. But in that itself, Israel makes sure that the community will not be reproducing. Add to that the damage or the direct bombardment of medical infrastructure and the killing of senior doctors and targeting them and attacking them. They make sure that people cannot access healthcare facilities and healthcare, which will induce and increase the complications and reproductive complication and also their death of other non-communicable diseases and infectious diseases. Add to that, that with everything that Israel is creating, among them the famine, so more people are being murdered by the famine. Among them, or most of them, are children, and they are more than or about 40 people now. Most of them are children killed with famine, and this is again ending the lineage of this family, killing the potential lives and those lives that does exist. The other technique or strategy that Israel is using is sexual violence as a reproductive violence tool for reprocide. The weaponization of sexual violence is a long tactic and against Palestinians, was used against men, women, and children alike. It increases the trauma and the humiliation and was documented on a large scale in this genocide. The UN at the first few months of the genocide have documented that Israel have used sexual violence and raped at least 2 women, and they humiliated multiple women and men by stripping them naked, by sexually harassing them, by putting them in open cages while they are naked, and also videotaping and taking photos of them and publishing them. At the same time, we know about the Siditi man sexual assault, specifically on men, where multiple men were raped by dogs, by sticks, by electric bars, by female and male soldiers. And there is that video that went viral on the 12 Israeli channel, which showed that a Palestinian detainee who was taken blindfolded and cuffed from the ground was raped by 10 Israeli soldiers. So he was gang raped and he suffered from paralysis after that, and a lot of problems at that area. So when we're thinking about that, it's not just the physical injury, it's not just the trauma, psychological trauma, the humiliation, and all of that. However, we need to think that this is also an attack against reproductive health. This man wouldn't be able to have normal intimacy. He wouldn't be able to produce normally, not only because of his paralysis, but also because of his psychological status. Add to that the other women, men, children who face the same situation, and how that would affect their ability to reproduce normally and become like part of the normal community that should have existed, but it doesn't exist now because of the Israeli occupation practices. So all of those levels of crimes are increasing. Add to them the many incidents of kidnapping children that we don't know anything about them. We know about 2 female or girls who are children. One of them is like months-old and the other one is 10 years old, 8 years old, Duha Talal. Both of them were kidnapped by Israeli soldiers, and we don't know anything about their destiny until now. The only thing we know is that Israel is known in Haaretz and many other like media platforms or media journals that it is the refuge of pedophiles. So it's very concerning and scary, and it doesn't only affect like those families that does exist right now, but it will affect the position or taking decision of bringing children to life for the Gazans and Palestinians, because they know their children could be kidnapped by the Israeli occupation and they could be sexually assaulted, unfortunately. So as concluding remarks, we need to understand that Palestinians know that Israel is using reproductive genocide as a tactic against them to annihilate them. And for that reason, part of the resistance is to understand that and to fight that. And this is what happens to the father, Fadi, was a father of 6 children murdered by the Israeli strike. And in an interview, he said, they kill our children so we don't survive. I want to have a child before being killed. I promise I will have more children and will never be annihilated. So Palestinians know that this weapon is used against them to prevent their reproduction and existence. That's why some of them, because of being aware of that, are trying to do what Israel doesn't want them to do, is to reproduce again. Many Palestinians are having such conversation, either to be antinatalist, not to have children, to live the same trauma, and to be tortured in the same way with the Israeli occupation and live a life full of suffering, or to bring children and be resistant to the Israeli policies against their reproductive health, or to hope to have children, but not now, and hoping that better times would come. But again, with better times, in the interview with Dr. Isra Saleh from Gaza, who's a sexual and reproductive health practitioner, she said that many people who are coming to her clinic and telling her they would like to have babies and all of that, and they're trying to follow up on the prenatal care, they're telling her that this time, doctor, could be the best time to have a baby. For us as Palestinians, specifically in Gaza, things only got worse. It never got better. So maybe this time is the better time than the time in the future. So it could be a better time to bring a child than the future. So what we need from all of you is solidarity and action, and not empathy. And thank you so much.